expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi everybody, welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and I am delighted to welcome to the show, everybody. We have Dr. Yoav Suprun. I'll be calling you Dr. Yoav, and you can reach him directly at 917-373-5428. Please text first before you call, texting preferred. And you can also reach him at Yoav, Y-O-A-V, at dryoav.com. And the website, simply www.dryoav.com. Has offices in Miami Beach and soon to come in Bay Harbor Island. Thank you, Dr. Yoav, for coming to the show.
Thanks for having me.
I appreciate you coming from Miami. I know there's a lot of traffic and there's a lot going on, and so I appreciate you coming and taking time out of your schedule.
Sure. Thanks for having me.
Absolutely. I am excited to learn about, I know you're a doctor of physical therapy, and I am so excited to learn about the different teachings and modalities. I saw something about the McKenzie method, so you'll have to tell me about that. But before we get into that, can you tell us, I always like to ask, what made you want to become a doctor, and specifically this type?
So I served in the Israeli Air Force from 1990 to 94. Came to New York City in 95. I'm an American citizen by birth. My father's American, so I got the dual citizenship, and I started as a personal trainer in New York City in the 90s. And unfortunately, in some of my clients' cases with back pain, sciatica, neck pain, and stiffness, some of the stretches that I recommended to those patients actually made them worse.
And you learned that as a trainer,
and I didn't know, and I didn't know why they got worse when I would stretch them or recommend some stretching. And so NYU was the first school on the East Coast to offer a clinical doctorate in physical therapy, DPT. I went to the program in NYU, and 3 years intense, good program. After that, one of my professors hired me, and she recommended that I'll take a course by a group called the McKenzie Method, McKenzie Institute USA. And I took first course, lower back pain and sciatica. And I managed to see the instructor on the stage teaching, guiding the patients that volunteer to be in our course, how to adjust their own spine every few hours, right? Many people think they need to go to someone to get adjusted. The instructor educated them on one or two specific maneuvers they have to do every few hours for the duration of the course. And by Sunday, the course started on Thursday morning. By Sunday afternoon, I saw that 90% of our patients got better, markedly better. Then I took another course that was dealing with neck pain and stiffness in the joints of the neck and pain radiating down the shoulder, down the elbow. I had that kind of pain for 8 months, and I actually was able to resolve my pain by learning certain strategies in the course. Once I resolved my pain, I started to take literally course after course. Now I am a senior faculty for the McKenzie Institute USA. So I teach healthcare providers, physical therapists, chiropractors, medical doctors, nurses about the McKenzie method. And we basically train the public how to take care of themselves. So one thing I like to say is I would want to teach you how to
Yes.
fish, I wouldn't give you the fish.
That's right. So you're actually empowering them instead of enabling them.
Correct.
And that is powerful because so many people that I know are like, oh, if I go to a chiropractor, I got to keep going and going back. But with the McKenzie method, you teach, I guess you would teach the patient the certain stretches or certain things.
So often there's certain things we do on daily basis that can throw the back out. For
Right.
example, sitting on low, deep sofa for a prolonged period of time, working on a laptop. We saw, for example, during the pandemic, a lot of people, even young people,
Yeah.
were sitting on their sofas and working from home, sitting from their bed, sitting from the kitchen counter, slouched forward, and developing what we call mechanical back pain. That's the pain you feel when you get out of a chair and you walk to the refrigerator to take
Yeah,
water,
I know
and
that.
the first 3, 4, 5 steps, you're like, ow, my hip hurts, or the pain is radiating down the leg, or the pain you feel when you're sitting in the car, stuck in traffic, and half an hour, 45 minutes into the drive, you start to feel this discomfort
Yeah.
radiating from the lower back down into the leg. And so we teach them how to treat themselves as well as prevent recurrence. That's an important sexy word to mention, prevention.
It is.
We're now at a point, especially the baby boomers, a big group of the listeners to the show,
Yes.
they have already had, trainers that train them and stretches and Pilates and yoga and all kinds of P90X and all
Right.
kinds of exercise routines, strengthen the core, and people are still feeling lower back pain, sciatica, and the public is asking, what do I need to do in order for me to age with an elegant upright posture? Can I age into my 80s and 90s standing upright? The answer is yes. You just need to assess the patient and find the 1 or 2 specific things they need to do daily.
And thankfully you brought your book, Aging Without Aching, and I was glimpsing through this, and what I really like is it's interactive in the sense where you actually show us the postures. Anybody who's listening, the book will actually show the different postures and I guess how to correct them. Maybe you want to tell us your inspiration and a little bit more about the book.
So the book, basically, I wrote it during the pandemic,
Okay.
and it was called Aging Without Kvetching, and many people didn't know what kvetching is, so we
Yeah,
decided to
okay.
transfer it to Aging Without
Not
Aching.
everybody's from South Beach.
Right, right.
Okay.
Or from New
Or
York.
from New York, yes.
And basically, the book deals with my story, how I started as a personal trainer, and what I learned through working with Robin McKenzie, teaching for his institute, how important it is to empower and give patients the tools to deal with daily activities of daily living. My patients never pack a suitcase on the floor, for example. They always elevate the suitcase.
Sure.
They always walk the airplane when they're flying international flights. They learned that sitting really could be the new smoking.
Yes.
That's
I've
why we're
heard
seeing a big switch now. A lot of companies, a lot of corporations are switching to high-low standing desk. We're seeing more and more tips that we are giving our clients, we're giving our patients, that if they implement them, their quality of life will improve. So in the book, which is also the title of my TEDx talk, and the
Oh,
listeners can see, if they put Yoav Suprun on Google, they can see my TEDx. It was done in Breckenridge, Colorado last year. I basically talk about how one can not just sit upright, but maintain the upright sitting posture. And that's something we were all told by our parents at some point at age
Yes.
5 or 6, sit
Yes,
straight.
that's true.
And then we cannot maintain it. And there are certain strategies that can allow us to sit straight and maintain it. For example,
Yes.
using a lumbar roll. This is a McKenzie lumbar roll. You can find it on Amazon or wherever you're buying items for the house. Basically, it's supposed to go into your lower back when you're sitting. So
Okay.
I'll scoot forward and I scoot my butt all the way back and I'm squeezing onto the roll. And the roll is maintaining the arch of my lower back. Most people are familiar with it in their car.
Yeah.
There's a button on the left side of the car seat. It's called the lumbar support. It's important for us to make sure when we're sitting that there is support in the lower back. Often, when people sit for a prolonged period of time, their back falls into what we call the letter C. Think of C for chaos. And then when you get up and you try to transfer your body from a C into an S, the spine is supposed to maintain an S curvature, people feel that stiffness. The stiffness can radiate down into the buttock or down into the knee or into the hip. And so the important component in the McKenzie method is to assess the patient. It's an assessment process, and find the 1 or 2 things that you need to do regularly, about every 2 to 3 hours for 4 or 5 days, and then slowly implement it into your life.
I like that because it really is allowing the patient to finally feel that we can do something just by getting the education, the knowledge, and the practice, right? And like everything else, it's a habit, it's a practice. But you brought some really great for the audience that is able to see when we air this on different channels. But can you share with us a little bit about is this the actual size of the spine?
So this is, for example, you can see there's vertebrae here, there's disc, here's the spinal cord, the nerves that are coming out of the spine. So if I want to raise myself on my toes, my brain sends a signal. The signal goes down the spine through the nerves that give power to my calf muscle, and I'm able to lift myself up on my toes. If something interrupts the flow of electricity from the spine down into the leg, and a great study called the EXPAS, Extremity Pain of Spinal Source, EXPAS study, authored by a Canadian researcher and 7 international researchers, his name is Richard Rosedale, looked at what happens when the spine gets angry and how we can have, for example, 71% of hip pain is often not your hip, it's your back.
Oh.
I have a patient in my office right now who replaced his knee, and he says to me, Dr. Yoav, this is a titanium knee. How come it hurts? It's not my joint. And when we fixed his back, we found that the back was causing his knee to hurt. So although it's not a joint, he did still feel pain because the nerve to the area wasn't happy. And so spinal models are great in explaining to patients what are the possibilities of pain. And there are many options where the pain can come from. It can be the facet joint, a disc, ligaments. It can also be osteoporosis. Here is a healthy bone, and here's an osteoporotic bone. So all these could be possible pain generators. Often we see patients coming to the office, hi, nice to meet you, here's my MRI results.
Oh.
And they say, look, I highlighted, it says I have severe stenosis, or I have severe degenerative disc disease. And I show them this is what degenerative disc disease looks like, or this is what stenosis looks like. And then I ask them a question. What do you have good and bad days? And often most patients say, yeah, there's days I feel, like you said to me before, there's days you're fine.
Yeah.
You throw your back out 2 to 3 times a year. Well, if you have severe degenerative disc disease or severe stenosis, and there's good and bad days, good and bad weeks, what happens to those severe changes on the MRI on the good weeks? And people look at me and
That's a
say,
really good point.
you're right, I don't know, it's still there. Yes, it's still there. On top of it, there's a mechanical problem. What's a mechanical problem? You sat for a long period of time watching TV or typing on your computer, then you went to the gym and you sat on a bike, and then you felt tightness and someone stretched you the wrong way, as I've done in the past, I admit. And so all of a sudden you start to have pain, aches and pains. And so it's usually when we interview a patient, we find that it's a cascade of events that leads to the moment that people say, all I did, I took a piece of paper out of the printer and I got stuck forward. And I felt like Satan stabbed me in the back. And
I'm laughing because I've had that.
It's so common.
Yeah, okay, good.
And the trick
Not
is,
the only one.
you're not the only one. And people say to me, I've already stretched my hamstrings and I strengthened my core And I still
helps.
experience
Does it help?
well, to some degree, yes.
Okay.
But most important is to assess and ask good questions and understand the environment that the patient is living in, working in,
Yeah.
and find the solutions within that environment so they can often take care of themselves. And that's, unfortunately, a lot of people are not aware that they can take care of themselves. They think that they need to see someone to get better. And we are now at a point, I think it's a nice change in history where the baby boomers, a large generation, is saying, I'm done getting stretch and massages and all the treatments.
We have a
What
quick
can I
commercial
do?
break. We're going to continue
You
this
got
great
it.
conversation. We'll be right
Perfect.
back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you, everybody, for tuning back in. I'm having a delightful conversation with Dr. Yoav Suprun. I'll call him Dr. Yoav. And you can reach him directly. Please text 917-373-5428. And the website is www.dryoav.com. And the email address is yoav@dryoav.com. 2 locations, Miami Beach and Bay Harbor Island, soon to come. And let's continue this conversation. We were talking about baby boomers, and I think we were discussing that so many people are coming to you with these, MRIs and all these different, results. And when they go to you, then it's like a whole different shift, right?
It's so important. There's something called drivers of pain and disability. A lot of the patients we see are afraid.
Yes.
They see their MRI or CT scan or X-rays, and someone instilled fear. If you're going to get hit from behind, you're going to become paralyzed.
Yeah.
Guys, we are not fragile. Often, I just need to handhold my patients and tell them,
I like that.
your pain often is mechanical. It has good and bad days, good and bad weeks. We just got to figure out what are the things you're doing that throw your back out,
Yes.
back or neck, spine, and then we teach you how to put your back in. And often that's doable, often. About 70% of patients actually don't need to be touched by me. I can have amazing hands. I do have excellent hands to mobilize someone neck or back. However, the damage occurs when the patient leaves the office. And that's why it's so important to teach them what they need to do when they're not with us.
Right.
When I opened my business in Sunset Harbor in Miami Beach in 2008, I decided that I will not accept insurance, I will not accept Medicare. And people say to me, well, how are you going to survive? Everyone else does. I said, you know how I'm going to survive? by number one, telling the truth, number two, teaching my patients, just like I teach my parents, everything they need to know when they're not with me.
Right.
So when my clients go fishing or golfing or they play pickleball or tennis or golf, whatever it is, they can do specific maneuvers before, during, and after, and they learn to check their body for stiffness, because often stiffness comes before pain.
Right.
And it's amazing how many people appreciate the good service. And my average is 5 visits, where the average of physical therapy
Wow.
is way north
lot.
of 10 to 12.
Oh, a lot more than that normally,
Yes,
yeah.
people go and, you often see 5, 6 people in the room. One is on the bike, one is
Sure,
electric
yeah.
stimulation, one is pulling on bands. It's you and me. You get educated, and the faster I can get you out of the office, the more your friends will come in.
Absolutely.
Because people are now hungry for fast solutions and tools or toolboxes that will allow them to manage themselves when they travel, when they're working.
Yes.
It's very, very important to empower patients and not to create dependency.
And you're also not having to be under the pressure of an insurance company. I would imagine if you are, then they would mandate rules for you.
Correct.
And so now you have the freedom to empower your patient. And like you said, the sooner they're out of there, then they're going to be talking your name.
Yeah. The initial evaluation is 75 minutes.
Yeah.
Where one of the chief complaints of patients is the doctor doesn't listen to me.
Yes.
There's patients who come to my office and they say, well, the doctor just looked at the MRI and decided to cut me here and here and there and fuse me. And what about asking questions? What about,
Yes.
we know that there's people who have MRI findings that are scary,
Yeah.
but yet they have zero pain.
Yes.
So how can you explain that? And we need to explain it to your listeners. Don't fall in love with your MRI findings. There's millions of people who have sad news on an MRI findings,
Right.
but they are pain-free. The problem in America is they created a system where you see
Yeah.
the radiological report by a radiologist, and then people see stenosis, degeneration, bone on bone, arthritis. They get
Yeah.
scared. Now what can I do for it? What should I replace? What should I inject? What should I do for those findings? And then
Yeah.
all we got to do is, some people do need injection, some people do need surgery, but the majority of people, one sentence that always sits in the back of my head, less is more.
I like that.
You most of your listeners who have friends who had surgery, they know a lot of the time there's recurrence. And if you don't educate the public on prevention, recurrence rate is high. My goal is to keep people active as long as possible. I like to get even people in their 60s or 70s. If you love to run, I'll get you back to running. There's ways to do it.
Nice.
Choice of exercise is really important. Many people are not aware that if they sit all day, for example, going to the gym and sitting on the bike is injurious for the spine.
Of course, right?
Yeah, but people don't make the connection.
Yeah. So what kind of lifestyle changes would you say? Because a lot of us after COVID have worked, we continue to work from home, me being one of them. What type of advice would you give to us? I know you mentioned standing desk, so that's going to be helpful. I see the McKenzie, the lumbar roll.
Yep.
I'm going to use it for a minute while we're
Yeah, please.
talking. And what else?
I think one of the best tips I can give our listeners, and that's something my 90-year-old mother and 95-year-old father are doing daily, is short, brisk walks. You don't have to walk for an hour in the morning.
Okay.
Because we sit so much,
Yeah.
you got to do 5 minutes out of the house, 5 minutes back to the house. You got to do it throughout the day. Try to do it. There's studies that show that it's an excellent thing to walk after a meal.
Yes.
Right?
Heard
So,
that.
yeah. So after breakfast, lunch, dinner, go for a 10-minute walk. It actually helps regulate blood sugar levels.
Nice.
Doing what's called functional fitness. What is functional fitness? For example,
We have 2 minutes left, so tell us in these 2 minutes, please. I want to know.
Okay, so
Functional fitness.
sit to stand. You don't have
Okay.
to master the squat, but sitting on a chair and getting up 10 to 15 to 20 times, few times a day, helps strengthen your legs in a functional manner So when you do get up as you get older, it's not an effort. You don't want to have
Right.
5 grab bars in the bathroom around your
no,
bed to
no.
pull yourself up. You want to spring up from a chair. So sit to stand is a really important functional exercise. Walking, stairs. It's very important to do weight training to make sure
Yes.
that the bones are strong as we get older. And so, these are some of the tips that often my patients receive, and I wrote them also in my
Yes.
book, Aging Without Aching.
I was going to say, last call, I wanted to remind everybody, please pick up this book, Aging Without Aching, Dr. Yoav Suprun. You can find this on Amazon. A lot of great, actually, there's a QR code on
All
many
the
of them, so
exercises
you can
have
actually
QR
see the
codes.
video.
Yeah.
So that's a great idea. So thank you, everybody, for tuning in. Thank you. Yeah, we appreciate you
Pleasure.
coming on
Thanks
and
for
sharing
having
with
me.
us. We'll see everybody next week. Wonderful evening.
Thank you so much.
Thank you.